10 Ways to Slow CKD. Hello, my name is Ellen. I am a retired renal nurse. I do hope you find this video helpful. In this video I will discuss the stages of chronic kidney disease. What you can do to slow the progress of the disease. You may have been told by your doctor or nephrologist that you or perhaps a loved one has chronic kidney disease, CKD, or end-stage renal failure, ESRF. This may have been expected or a shock. Our kidneys are so efficient that you can lose 90% of their function before symptoms show up. This can mean that there are many people who don't know they have renal disease, CKD, chronic kidney disease, or even ESRF, end-stage renal failure, until they have symptoms, or it shows up on a blood test. Chronic renal disease progresses slowly and is measured by stages from 1 through 5. The stages are based on something called glomerular filtration rate, or eGFR. The glomerular filtration rate is the best test to measure your kidney function. The glomeruli are the little filters inside the nephrons. It is calculated by measuring the level of creatinine in your blood. Creatinine is a waste product that comes from muscle metabolism. It is produced from creatine, which is important in energy production in the muscle. Most of the creatinine is passed out of your body by the kidneys. Other things considered are your age, gender, weight, height. The stages of chronic kidney disease. Stage 1, eGFR 90 or more, kidney damage with normal function but protein in urine. Percent of function 100 to 80%. Stage 2, eGFR 60 to 89, mild decrease in kidney function. Percent of function 80 to 60%. Stage 3, eGFR 30 to 59, mild to moderate loss of function. Percent of function 59 to 30%. Stage 4, eGFR 15 to 29, severe loss of kidney function. Percent of function 29 to 15%. Stage 5, less than 15, kidney failure. Less than 15%. Testing your blood for your eGFR may not be the only test ordered by your doctors. An ultrasound to check on the size or problems with your kidneys. A biopsy of your kidney. An electrocardiogram ECG to check your heart. Tests for diabetes. Test for protein in your urine. Even if you have kidney disease, it does not mean you will progress to kidney failure. The milder your CKD is, the more chance you have that it may not progress, with your help. The more severe, the greater the chance you will progress to end-stage renal failure. There's no magic rule as to how long it could take to progress to stage 5, which is called end-stage renal failure. Once you are there is no further to go, and you will need treatment to stay alive. The less you do to help yourself to stop the progress, the more likely you will be to end up with end-stage renal failure. Work with your doctors and other health professionals. If you have been diagnosed with CKD, you will have been referred to a nephrologist, a doctor who specializes in treating kidney disease. Follow their advice and ask questions. However, whatever stage you have been diagnosed at, there are many things you can do to slow down the progression of the disease. Things you can do. Control your blood pressure. You should aim to keep your blood pressure under 120/80. Take your blood pressure medication as prescribed. The main blood pressure medications prescribed are angiotensin converting enzyme, ACE inhibitor, or an angiotensin receptor blocker, ARB. Buy a blood pressure monitor and take your blood pressure at home in the morning and at night and record them. Don't stop taking your blood pressure tablets, even if your blood pressure seems fine and you feel well. High blood pressure seldom has symptoms. Talk to your doctor if you think you may have side effects from the medicine, but don't stop taking them on your own. Have your pharmacy make up your pills in a blister pack or put them in a dosette box to make it easier to take your pills regularly. It's possible that you may have been put on blood pressure medication even if you don't have high blood pressure, but have diabetes or protein in your urine, because it can be protective in CKD. Keeping your blood pressure under control will not only help slow the progression of CKD, but can protect from heart disease and lower your risk of a stroke. If you are a diabetic, it is important that you keep your blood glucose level in a healthy range between 4 to 7 ml/liter or 72 to 126 mg/deciliter. Record with your BP and take to your next medical appointment. Take your diabetic medications as directed and talk with your dietitian about a healthy diabetic diet. Doing this can slow the progression of your CKD and help prevent other complications of diabetes. You may be referred to a dietitian through your health service, and they can offer you advice. There are also cookbooks for the renal diet. Limit your sodium, salt, intake. High salt intake can increase the amount of fluid in your bloodstream and lead to raising your blood pressure. There are a lot of foods with added salt. Processed foods. Some cereals and fast foods are often high in salt plus table salt added during cooking and used at the table. Limit fatty foods, those high saturated fats and cholesterol. Again, processed foods, fast food etc. are high in fat. You may also be advised to limit the amount of protein, red meat, chicken and fish. This helps your kidneys so they don't have to work so hard to get rid of the waste from protein breakdown. Limit the foods you eat that have phosphorus in them. Phosphorus and calcium work together in your body. When your phosphorus gets high, it draws calcium from your bones and leads to bone disease and weak bones. This is a very complex relationship, and you will be watching your phosphorus intake and will be prescribed medications to treat this as your disease progresses. There is high amounts of phosphorus in dairy foods, nuts, beer, and cola drinks such as Pepsi and Coca-Cola and Diet Coke. A better choice is ginger ale, creaming soda, root beer and light clear drinks such as Sprite and 7-Up. Limit your intake of cola drinks because of their high phosphorus content. Soda, soft drinks, are also very high in sugar. It's not easy to have the healthy diet you need and balance your intake. Your dietitian can help you. There are lists of the potassium content in some fruits and vegetables. You can have more of those that are lower in potassium than those that are high. Once again, your dietitian can help you find the balance to have a healthy diet. As your disease progresses and your kidneys no longer make as much urine, you may also be asked to limit your fluid intake. This will help with your blood pressure, your heart and with swelling in your face, hands and feet. Other lifestyle things you could do. Lose weight if your BMI is over 30. Stop smoking. Cut back on your alcohol. Following these recommendations can slow the progress of CKD. There is a possibility that these measures started in the early stages could see you living with CKD but not progressing to ESRF. However, there is no guaranteed time frame as to how many years you may get before ESRF, but anything you do will help. To see more videos and learn more, go to our channel, https://www.youtube.com/@michaelmoriartyhwh/videos. We hope this helps you. Ellen and Michael Moriarty, 2 RNs.